What is acne syndrome, causes and risk factors, treatment, protection? Acne or pimples, regardless of the name, may be a constant daily nuisance. Healing from acne is slow. As soon as it begins to disappear, others appear that were waiting. This endless and continuous battle is repeated over and over in a tired and desperate manner. It is likely that hormones play a major role in the emergence of acne and making it a nuisance for young people in particular. However, people of all ages may suffer from counting. Also, some women may suffer from acne in moderation at different stages of hormonal changes that intersect their lives, such as pregnancy, the menstrual cycle, when using the contraceptive pills or when they stop taking them. Acne symptoms. Acne appears on the surface of the skin of the face, neck, chest, back and shoulders. These are the areas of the skin that contain the most effective sebaceous glands. Acne appears in various forms, such as white or black heads. These heads appear when the pores containing follicles are clogged by the milky secretions, greasy, dead skin cells or germs. When the heads are open towards the surface of the skin, they are called blackheads, a metaphor for the black color of the material collected in the hair follicle. When these heads are closed, they are called whiteheads, which protrude from the surface of the skin and appear as skin-colored bumps. Cums, pimples with blackheads protruding on the surface of the skin are an indication of inflammation or infection in the hair follicles. They are usually red and painful. Purulent swellings, like comedones, they are red, raised and painful and also have an inflamed head, white in color, on their extremities. Lumps, large, hard, painful swellings that form under the surface of the skin, caused by the accumulation of secretions in the depth of the hair follicle. Cysts, vesicles, cysts, painful pus, filled, made up under the surface of the skin. Inflammation of this type may leave scars. Causes and risk factors of acne. There are 3 reasons that may help acne. 1. Excess sebum production. 2. The irregular leakage of dead skin cells stimulates the hair follicles in the skin. 3. Accumulation of germs. There are 3 reasons that may help acne. Acne appears when the pores of the hair follicle are clogged with milky sap and dead cells. Each bulb is connected to a milky gland. This gland secretes a sebum called sebum that lubricates hair and skin. In general, the milky sap heads out along the hair canal until it reaches the surface of the skin. When the body excretes an excess of milky juice and dead skin cells, all of these may collect in the hair follicles to form a soft blockage. This blockage may cause the hair follicle wall to swell, leading to the formation of a whitehead. The blockage may work its way out of the surface of the skin, becoming black and a blackhead. Pimples are red spots protruding from the surface of the skin, and white in the center, formed as a result of contamination of the aforementioned blockage in the capillary channels, and then its inflammation. Blockages and infections that are deeper in the hair follicle cause swellings to form under the indicated skin called cysts. Other pores in the skin, which are the openings of the sweat glands, do not generally contribute to acne. Contrary to what is known, nutrition has little effect on acne, and it does not appear from pollution. In addition, excessive scratching of the skin or cleaning it with lotions, and chemicals may worsen the situation of pimples due to stimulation of the skin significantly. Hormonal changes. Hormonal changes in the body, too, play a role in the appearance or worsening of acne. These changes are especially common in young people, both males and females. Young women or women 2 days, a week before the onset of the menstrual period. Pregnant women. People who take certain medications, especially cortisone. Other risk factors. Other risk factors include skin exposure, directly to the skin, to oily materials or to certain cosmetic products. Previous cases of acne in the family. If parents suffer from the appearance of counting, then children are likely to suffer from it as well. Friction or pressure on the skin as a result of using a landline, cell phone, helmet, neck strap, or backpack. Acne treatment. The treatment of acne depends on reducing the production of milky sap and sebum, increasing the rate of skin regeneration, treating bacterial contamination, reducing inflammation, or combining these 4 compounds. Acne treatment period. Treatment for acne in young people or adults may range from a few months to a few years until complete recovery. The effect of acne depends on the extent of its spread and its severity, as it may generate psychological distress and may even leave scars on the surface of the skin, and then we need to treat the scars of acne. Fortunately, there is an effective treatment for acne, either by a dermatologist or independently. Treatment for acne in minor cases of acne. Acne is, in general, by simple means, such as cleaning the skin daily with a mild cleansing lotion and using an ointment that does not require a prescription. In severe cases, treatment for acne generally depends on one or more types of medication that can only be obtained medically. Some preventive measures will help preserve the skin and prevent the recurrence of acne. Methods for treating acne. All of the proposed types of acne treatment, do not give immediate results, but results begin to appear after 4 to 8 weeks, so that the situation may worsen in certain cases before the improvement appears. Your family doctor or treating dermatologist may recommend medicinal acne treatment that is either applied to the surface of the skin, topical treatment, or swallowed, oral medications. It is forbidden to use prescription oral medications during pregnancy, and especially during the first trimester. The different treatments for acne also include 1. Topical treatments. Creams and emulsions for treating acne or acne, dry the milky sap and oils, eliminate germs, and stimulate the shedding of dead skin cells. Preparations that do not require a prescription are generally soft and contain active ingredients such as benzoyl peroxide, sulfur, resortinol, salicylic acid and lactic acid. These substances are effective when pimples are mild. 2. Medicines. If the pimples do not respond to these treatments, it is best to go to your family doctor or dermatologist to obtain a prescription for more effective lotions or emulsions. Retinol and odpelin acid are 2 forms of drugs for the treatment of topical, produced on the basis of the vitamin A. These drugs depend on stimulating cell regeneration and prevent the formation of blockages in the hair follicle. In addition, there are certain medicines that mimic with their effectiveness the antibiotics used for topical treatment. These medicines work to eliminate germs from the surface of the skin. To obtain the best result, the therapist may need to combine more than one drug at the same time, such as antibiotics, isotretinoin. Preventive measures to be taken orally. Laser acne treatment. Cosmetic treatments, chemical peeling or microdermabrasion, may be effective for treating acne. The doctor can take certain procedures to treat and reduce the scars left by acne, including soft tissue filling, peeling discolored skin, dermisabrasion, a layer of the skin located directly under the epidermis, laser therapy, light source and radio waves therapy, skin surgery, prevention of acne. Even when the warts heal, acne, or disappear completely, it may be necessary to continue drug treatment or any other treatment, in order to prevent their reappearance. In some cases, continued topical drug treatment may be required in places where blisters are likely. Persistent use of preventive measures or continued phototherapy to protect the skin and keep it free from acne. You should talk to the attending physician about prevention methods to prevent the recurrence of pimples. You can prevent acne from reappearing by following household means, such as washing and cleaning the skin with a mild cleansing lotion, and you should of course refrain from touching and rubbing the affected areas. Tips to avoid acne recurrence. There are additional ways to prevent acne from recurring. Acne include washing the exposed areas twice a day, the use of anti-acne medicines that can be obtained without a prescription, in order to dry out the excess milky sap in the skin. Avoid using cosmetics, makeup, too much. Remove these powders before bed. Wearing loose-fitting clothes that do not stick to your skin. Showering after exercise or other physical activities. For any inquiries or questions, add your comment. And don't forget to subscribe and activate the notification to receive all new